Sleep apnea is a serious, potentially life-threatening condition where people stop breathing in their sleep. There are two kinds. The most common kind is called obstructive sleep apnea, and that's where there is some sort of mechanical obstruction in the airway. The other type of sleep apnea is called central sleep apnea, and that's where the brain somehow doesn't communicate to the muscles that you need to breathe. Now, if people stop breathing in their sleep, not only are they not getting sleep, but they may die. There's several ways that sleep apnea can be treated. One way is with a dental appliance that repositions a person's jaw into a position that removes part of the obstruction. Another way is with CPAP. CPAP is where you wear a mask with a machine that actually creates a positive airflow. It basically pumps air into your body. Surgery is another option. Sometimes when people hear about sleep apnea, they think, gosh, I don't sleep well, but I don't really think I'm going to die in my sleep. But here are some other things that you ought to know. One is that when your body doesn't have enough oxygen, it makes all other medical problems worse. For people with diabetes, it gets worse. For people with cardiovascular problems, it gets worse. With things like hypertension or risk of stroke, it gets worse. There are many things that might indicate that someone possibly has sleep apnea. Probably the most common one would be snoring. Now, not all snoring is harmful, and not all snorers have apnea, and not all apnea patients snore, but that's a common sign. Another thing is just simple fatigue. People that doze off at inappropriate times. People that fall asleep in church or that fall asleep driving. People that can't keep their eyes open after lunch. These problems are much more common in people with sleep apnea. Sleep apnea is a serious issue. If you think you might have it, if you think your spouse might have it, you owe it to yourself to investigate, and let's find something that can help you keep your health.